About 500,000 people in the U.S. are treated for severe burns every year.
Beautiful, brave young women with a promising
20 years ago, 17-month-old triplets turning a terrible tragedy in time. In the past, laser treatment has been an effective way to reduce the effects of recent burn scars. But now, a laser procedure is offering hope to 3 sisters, triplets, and their 20-year-old scars.
When we were 17 months old, we were in a house fire. All 3 of us received third-degree burns on different parts of our bodies. Our mom died from the house fire a couple days after it happened. We were in the hospital for months and months afterwards, you know, trying to recover and get better.
Trey had called and left a message on our answering machine, and one of our front desk people pulled that message and gave it to me. I called her back and we discussed the fact that in order to really evaluate her scars, I would need to see her in person. At the time, I honestly did not fully put together that they were triplets and they had all been in a fire and that these scars were 20 years old. But they then got in the car with their grandmother and drove from Texas for 4 days to have the consultation.
We have discussed over several years the potential of using the UltraPulse laser for burns and scars. The UltraPulse is 6 times more powerful than any other laser out there. We realize that we have a potential to effectuate a real distinct improvement on burn scars.
The laser procedure we're planning on using is the Luminous UltraPulse Total FX, and that particular treatment has 2 different laser handpieces.
With the Deep FX now, we can go to 2 full millimeters deep within the skin. And when treating scars, you can treat the full dermal thickness of the scars, where before you couldn't do that. And second to that is the thermal damage you create around that micro channel you can drill with the Deep FX. That initiates the wound healing response, which then creates new collagen and new tissue within the scar itself. And finally, the Active FX, we have a 1300 micron spot size that we use to resurface the skin.
And we really need both of those to treat the burn scar. The treatment time will range anywhere from 1 hour to 3 hours, depending on the severity and the locations of the scars of each girl. For the first week, they'll be very red and swollen, and then there'll be some peeling. At the end of 7 days, there'll be some sense that the color is more homogeneous or more similar, and that the texture is smoother. Over the next 3 to 6 months, there'll be a continued improvement. In the face, I think we'll see the most improvement. The arms are going to be a little slower. We may need to do additional treatments, but the alternative is to not treat them at all. I've been working with burn scars for years and have seen amazing improvements that have changed the patient's life.
For me personally, with my scars, the coloring is definitely like all uniform. The scars are so much smoother. Like for my...
Can you show me your arm?
Yeah,
because,
sure, I'll show you.
Okay, so where do you notice the biggest difference on your arm?
Well, mainly right here is the biggest difference. It was I don't want to say rough, but it was a lot thicker, and now it's just really smooth. And especially right here, the UltraPulse really helped lessen the thickness of my scars, and I have more flexibility now.
You get true physical improvement of the scar itself, as well as improvement within the skin itself that you'll never see, but the patient will certainly feel and appreciate.
And I think this treatment is very promising to both burn patients all over the world, as well as physicians that treat burn patients.
What's it done for you emotionally?
Emotionally, just knowing that there's actually a treatment out there that can, you know, change the look of our burns and hopefully heal them completely is just, that in itself is just an amazing feeling.
And also just knowing that there's hope out there for other burn survivors to help the appearance, that's just really good to know.